Welcome to Channel 17, the Town of Colonie Government Channel.
Hello, I'm Colonie Town Judge Peter Crummey, and welcome to Benchmark. We'll explore a variety of issues involving our legal system, our justice system, and how they intersect with the citizens of the town of Colonie. Today, we are truly fortunate to have as our guest John Faso. John is a practicing attorney who also has served our state in a variety of different capacities and actually enjoys one of the deepest resumes of public service throughout the state of New York. John Faso served our state assembly for 16 years and served as minority leader for 4 of those years. He was in front of and championed a variety of pieces of legislation which ultimately became law here in the state of New York. His influence here in the Capitol has long been known and appreciated throughout our entire state. John, thank you for joining us today.
Well, Judge Peter, thank you. Thanks very much for having me, and it's a pleasure to be with you. And I know we've talked about doing this program for a number of months, and I've looked forward to it, and I'm glad we had the opportunity.
Well, you know, John, obviously your professional career is long and deep, and certainly as a public servant, certainly without parallel here in the state of New York. And your commitment to the entire state and the citizens is certainly well recognized. There's a variety of things that you've accomplished over time in public service, and you continue outside of public service to continue to share ideas about good government and ideas impacting a variety of different areas, even as you currently practice law.
You're very kind. I don't know if I would be as fulsome in praise. After all, the last election I ran for governor of New York against Mr. Spitzer in '06, I was trounced. But I think probably my political experience was a very good one. I enjoyed representing people in the state legislature and in public service all around the state, and so it was rewarding. But now I have the ability to say, well, I'm a statesman because I'm a retired or defeated politician.
Well, that's quite all right, and certainly all of us have enjoyed the silver medal on Election Day, and you and I are no different than that. But nonetheless,
right, we
impacted the environment in any event. And so we're thrilled that you could cut away some time for us today.
Yep.
Looking at your assembly involvement, for just briefly, some of the things that you championed at the time, which are now in full bloom here in the state of New York. Charter schools is an issue that you were up front on back in the 90s. And tell me how that got going.
Well, I had long been concerned with the lack of performance of many of our school children. And the fact is that our education system is heavily bureaucratized, as you would expect something evolved through many years and decades. But what we saw was that there wasn't, where the lack of performance was particularly apparent among in our urban centers and some of our rural areas in particular. And it's not just about money. It often, many of the schools in places like Albany or New York City or Buffalo were spending well above what the state average was for on a per pupil basis, K through 12. And so what we wanted to do was mirror some of the reforms that have been enacted throughout the nation. And charter schools started probably 30 years ago in the state of Minnesota and Wisconsin, and they were the first steps. And basically, just so your listeners and your viewers know, charter schools are public schools. They are open to anyone who applies. But what they are is they are governed differently. They are not governed through the traditional public sector. They are not part of the local school district. The funding comes through the local school district because it follows the child, and the charter gets about 75% of the funds that would flow to that school district for each child. The other big difference is that they're more flexible. The employees in the school do not automatically have to be members of the teachers union or the other bargaining units that you would have in your traditional public sector. While the employees certainly have a right to organize in unions, candidly, most of them in the history is they don't, because they appreciate the flexibility, the dynamism that comes with the charter school environment. And so I'm pleased to have been associated with that movement. Another piece of legislation that I championed when I was running for governor, in fact, was the property tax cap. And you see that now has come to fruition in the last couple of years.
That's right.
Governor Cuomo championed that after he was elected in 2010. And the reason for the need for the property taxes, our property taxes were 70% above the national average. In New York, frankly, there was never enough consideration for what could the taxpayers afford. It was simply, here's the bill, pay it. And as we see in our neighboring state of Massachusetts, over 30 years ago, Massachusetts adopted a property tax cap. They did it with voter initiative through a referendum, which we don't have in New York. And I would like to see us have some limited kind of referendum, but we don't have it. And but in Massachusetts, they have probably the highest achievement standing of any state in the nation. Their students do extraordinarily well. They spend about $3,000 less per student than we do, but they still spend a lot of money. They spend more than the national average themselves in Massachusetts, but it's just the cap that they have in Massachusetts called Proposition 2.5. It has required the local governments and the school districts to live within the means of the taxpayers. And I hope that we can accomplish the same thing here in New York. The one thing that has not been done at the state level that needs to be done is mandate relief, to give more flexibility to the local school districts and to local governments to operate, to free them from all the constraints in terms of bargaining with employees and how they pay for benefits and retiree health care. That's 70% of the cost for government and for local school districts in our state. And candidly, that's where they need the most flexibility now. But the property tax cap has to be accompanied by mandate relief, so we're half the way there.
Well, those are all very significant issues which are on the forefront of everyone's mind daily. I see it routinely reported on those issues. And of course, my years as a county legislator here became well aware of the mandates that fell onto counties as well. And we were constantly trying to work on ways to deal with that.
And the biggest one is on counties is Medicaid.
You bet.
You know, I often would say that the single worst mistake that Nelson Rockefeller ever made as governor, it was in the 1960s when the federal government adopted Medicare and Medicaid. And it's important for our viewers to distinguish Medicare for senior citizens, Medicaid for the poor, and that also includes folks that might be in nursing homes. But New York, virtually alone among all the states, when the federal government said we're going to create this 50-50 program where the federal government pays half of the Medicaid cost and the state pays the other half, New York, virtually alone among the states, took half of their share, 25% of the total cost, and imposed it on the counties and the city of New York. And it really it violated a fundamental premise about how government should be organized and run, in my view, which is they separated the level of government which conferred the benefit, namely the state, from the level of government that had to raise the taxes to pay the bill. And so by saying we're going to give you a level of benefit up here, the state policymakers, governors and legislatures of both parties 30, 40 years ago, what they did through the years is that they put all of this cost on the counties and the city of New York, disproportionate to anything that they had the capacity to pay for. So now you'll see places like Albany County and many of the counties in this state where virtually every dollar of their property taxes that they raise goes just to pay the Medicaid mandate. And the rest of the revenue that a county government might have might come from primarily a sales tax. So it's a fundamental, it was a fundamental mistake the way the state did it, and that was Nelson Rockefeller who did that, and it was a big, big error.
And it continues to visit us today in a variety of different ways, too. And, speaking of these issues involving health care, I see that over the course of the spring, on many occasions, I had noticed that you had letters to the editor published and in a variety of reports that you made concerning the Affordable Care Act that had been adopted certainly by Congress and the Supreme Court. Actually, the whole act, I believe, was presented to the Supreme Court in the case NFIB versus Sebelius, and that went right to the Supreme Court on that issue. And as I best recall, the Supreme Court did actually find that that act was constitutional. But it seems that in connection with that particular act, as in other efforts by states and the government to manage health care, that it continues to be based on the similar type of footprint where there's a third-party payer situation, which may not ultimately be the best way in order to manage health care costs. What do you say about the Supreme Court decision and what we have now?
Well, you're right. I mean, the Affordable Care Act, which the Congress enacted, the President and the Congress in 2009 and 2010 enacted this legislation. And basically the premise of it was that we would provide health insurance for about 30 million uninsured people, and that we would be able, the Congress and the federal government, through basically administrative efforts, would be able to constrain the costs of providing that. Now, half of those 30 million people are going to be pushed into the Medicaid system, which is quite an interesting dynamic. And the constitutional issues that surrounded this Supreme Court argument were fascinating. There were political issues, there were constitutional issues. When they adopted it in the Congress, the Obama administration and the Congress said, we're doing this under our authority under the Commerce Clause to regulate interstate commerce, and the theory was that everyone at some point will need to procure health insurance. Those who do not buy health insurance are, in essence, even by their inactivity, affecting interstate commerce.
Right.
And so therefore we have the power to do this. The argument came from the other side saying, hey, wait a second, and this was NFIB, which is the National Federation of Independent Business, and a number of states brought suit against this. And the argument was, look, how can you regulate, how can inactivity be described as something that is affecting interstate commerce? And if I decide not to buy something, can the government require me, even though it might be in my best interest, can they require me to do this? So we went back and forth for many months. This went through district courts and circuit courts of appeals throughout the country. And of course, wonders of wonders. The Supreme Court decided on a 5-4 vote that indeed the Congress did not have the authority under the Commerce Clause to enact this legislation. However, Justice Roberts, Chief Justice Roberts, decided that we would basically decide that the provisions that were in there, the penalty provisions that were in the Act, which an individual would have to pay if they didn't buy health insurance, that penalty really was a tax. And I had been saying to some of my conservative friends for many months that, look, it is no doubt in my mind that if the Congress had said at the outset this was a tax, it would have been constitutional. But there also is no doubt in my mind that had they said it was a tax at the outset, it never would have passed. So both liberals and conservatives had some of their cherished assumptions overturned in this process. At the end of the day, Chief Justice Roberts, I think, said that, look, folks, this is a political question. And ultimately, the political process We're going to give deference to that, to an act of the Congress, no matter how narrowly it was passed or no matter how it was pushed through. And there were a lot of kind of sordid details in terms of how this thing was ultimately enacted. But that's the traditional sausage making of the legislative process. And he basically said, look, it's not what you said it was, Commerce Clause, and it actually is a tax, and I'm not going to rescue you from your mistake. You, the people, you, the legislative branch, you've got to fix this if you want to change it. Ironically, they did, however, uphold one of the arguments that 26 some odd states made, which was that the national government, the federal government, could not coerce the states into adopting the Medicaid part of this proposal. So one of the interesting things going forward will be how many states will actually adopt the Affordable Care Act. And remember, as I said at the outset, half, 16 million, half of the people who are uninsured in the country are actually going to be pushed into the Medicaid program. So the open question going forward, and there'll be, obviously the elections in November will decide some of this, but regardless of what happens in November in those elections, there will still be issues that have to be legislatively addressed as this thing goes forward.
Right. And John, doesn't it appear, though, that nonetheless, like so many other models that government has adopted to manage health care, that in your opinion, it may be missing a key component? If we're trying to manage costs, the structure and that has been given by a government historically may not be the best way to manage costs.
Well, I mean, it's let's face it, government loves to tell people we're going to give you something for nothing. Milton Friedman famously said there is no such thing as a free lunch. And look at the healthcare system that we've kind of jerry-built through the years. The reason most people in America get their health insurance through their employers has to do with World War II and wage price controls. In World War II, employers could not pay people raises because of wage price controls. So what they did was they said, in lieu of getting a raise, we'll provide you this benefit, health insurance. And they would provide basically catastrophic coverage, not first dollar primary care coverage like we have today, but basically catastrophic coverage. And gradually that evolved through the years into a much more elaborate, expensive kind of system. But most people today who are employed receive their health insurance through their employer. What that means is that you've got a situation where there's no economic relationship between the healthcare consumer and the provider. You don't walk into the doctor and say, well, how much will that operation cost, or what's this procedure? Basically, right. You don't care what it costs. The doctor doesn't care what it costs because it's the third-party payer who's paying the bill. Your employer cares, and that's why we've had so much consternation about the increase of healthcare costs through in the last few years in particular. This is kind of akin, in my view, to going into Hannaford or Price Chopper. Taking your car, going through the store, not having a single price on any shelf or any item, and you get to the checkout counter and you say, here's my co-payment. Very few people who receive medical treatment ever know what the real cost is, or do they care? And I think we've gotten away from, health insurance is really not insurance the way we think of, say, in automobile insurance or property and casualty insurance for your home, where you have an accident, it's going to cost you a lot of money to repair the car, you pay the deductible, and you get the car fixed. But you don't go to your car insurance provider every time you need the oil changed, or the tires changed, or your alignment fixed. You don't do that. But we've actually created a system which is really not health insurance. It's really prepaid health benefits that we pay through our co-payments, through our premium support that an individual may pay, and largely through what your employer pays. And I think unless we move to try to get more individual stake and skin in this game, we're going to be forever failing in our effort to actually control costs. Because You don't care, and I don't care as the medical consumer and the provider as to what it costs, because that third-party payer who's actually paid by the employer, that's the one who's paying the bill.
How can government introduce a more market-based healthcare program?
Well, one of the things that could be done is more flex spending accounts where people have the ability to use pre-tax dollars to pay for routine medical expenses. And also high deductible health insurance plans where you pay up to a certain amount, a few thousand a year. You pay those costs directly to the provider out of pocket, and then if you have a catastrophic illness, you have an injury where it's gonna cost you a lot of money, that becomes more of a traditional insurance model. Unfortunately, we're not going in that direction in this country. The Affordable Care Act, in fact, takes us further down the path towards really a fully socialized model. And one of the anomalies in the Affordable Care Act is that if you don't buy health insurance, you pay this tax, as Judge Roberts calls it, or a penalty, as the Congress and the administration would call it. You pay that, but the employer, if the employer doesn't buy you health insurance, provide you health insurance, the employer pays a penalty up to $2,000 per person. Well, the typical employer-paid plan is over $10,000 a year. Right. So I believe there will be a perverse incentive for many employers actually to drop coverage altogether and push people into the healthcare exchanges where they would then receive a subsidy, a credit from the government to buy the plan, the health coverage directly for themselves. But if you have a financial incentive as an employer, and if employers start doing this, where they will never be able, with the subsidies that they have funded, they're assuming that employers basically are not going to do that. But if you're the employer, you're the small business, or say you're a larger business, and health insurance is costing you $10,000, $12,000, $15,000 per family or per employee per year, and you have the choice of paying that $15,000 for the coverage or paying the $2,000 penalty, I think it stands to logic that a number of these employers will find that to be more advantageous financially and will do that. That will then drive people who will then procure their health insurance through these state or federally based exchanges, which is a big piece of the Affordable Care Act. And if you do that, you get thousands of dollars of credit to buy that health insurance. But the assumptions that the Congress made when they did this would not account for many employers actually dropping coverage. So that's a potential landmine in this entire thing. Needless to say, there'll be much written and said about this as we go forward. This is not the end of the story by any means.
Well, and that's sure. And isn't it also true that the Affordable Care Act includes some programming that New York has long already engaged and adopted? And if that's true, do those New York programs, or have they ever proven that it actually that they are worthy of adoption by the federal government?
Well, you know, it's interesting that you asked that, Peter, because a number of the pieces of the Affordable Care Act that we hear about, for instance, the what's called guaranteed issue, which means that whether you have a pre-existing condition or not, you still are able to buy insurance. Well, we've had guaranteed issue in New York for many years under state law. The way it works in New York is that you can't just you can't be sick one day without insurance and the next day walk in to the insurance company and have them sell you the insurance. You have to wait 9 months before you can actually get coverage. But the company has to sell you the coverage, albeit you have to wait 9 months to get covered, because they didn't want to create this perverse system where you'd never have insurance until you absolutely needed it. But New York has had that, and it has made the individual market for insurance extremely expensive in New York. In fact, it's unaffordable for most people. Right. I mean, we're talking having to pay premiums of $2,500, $3,500 a month in many of these individual market plans in New York. The other piece that New York has had is community rating for many years. In fact, This was enacted when I was in the legislature back in the early 90s. And community rating says that an insurance company can't basically perform analysis of the groups that they're covering based upon age or based upon other health risks that that person might have, and that basically you throw everyone into the pool and therefore you spread the risk. Now there's a logic to doing that, but there's also an impact. One of the impacts is that if you're a healthy 22, 26, 28-year-old, insurance is extremely expensive for you today.
Yes, it is.
Because of a community rating. So we have to recognize that none of these things, the government doesn't have a magic wand. It can't make the costs go away. One of the perverse things, I think, in our kind of notions about health insurance is that somehow we can get things for free. Nothing is for free. There's always a cost ultimately, and there's an awful lot, as I said before, that's going to still be written and debated and argued about on this entire issue in years to come.
Well, we certainly appreciate your in-depth knowledge on that particular issue, and we look forward to hearing from you in the future as to those issues. In the meantime, of course, you're actively practicing law here in the city of Albany with a distinguished international firm.
Yep.
And tell us what the types of things you're doing now in connection with the practice of law.
Well, we represent in our Albany office many companies, associations, trade associations. They might be insurers, they might be manufacturers. Basically, we represent businesses who have regulatory, legislative, or administrative issues with the government. And virtually every aspect of my practice touches on how the government is regulating their industry or their business.
Sure.
So I might represent clients before the state legislature, before state agencies. We might also work with local governments around the state. And also some of our practice takes us to Washington, D.C. and New York City, where we have offices as well, and working on issues, similar issues in those venues.
Well, it's certainly a wide and varied background that you can bring to that particular position as well. Early on, I think you and I first met probably in 1986 or so. I think you were first launching your first assembly campaign, and I was actually running for state senate at the very same time here in Albany County, and we found ourselves in together on a variety of occasions. And I remember one time you were we were down, I believe, at the Ravenna or Queens gathering in a restaurant down there, and an upstairs of a building down in Glenmont, I think, actually at the time, and you were the guest speaker. And rightfully so. And you mentioned something about lawn signs looking like real estate signs. If they were real estate signs,
right,
you would be in great shape.
Well, I always had one advantage in the lawn sign business running for office, is that I have a 4-letter last name. So you could make it exceedingly big. But I did have many people initially say to me, gee, I thought that was a new real estate firm, because the people see these signs out there. And one of the mistakes I've always found the candidates make, that with a 4-letter last name I didn't have that problem. They tend to put too much on their lawn signs, because these are basically just out there to try to get some attention, some name identification. But the best kind of campaigning that I always enjoyed was the door-to-door, because
that's right,
you actually got to see people. It was probably very brief, and indeed you had to be brief because you had to get to the next house.
Right.
But you wanted to basically put your face and your name and your pamphlet in front of that voter. I always found that to be the most effective campaigning, and I did actually enjoy it. You know, if you don't enjoy dealing with people and working with people, public office is not some place to be. And I've found, in my experience, is that most elected officials, whether they're Democrat or Republican, liberal or conservative, are motivated the right way. There are some glaring examples where that's not true, which we all know about, but that was always my motivation.
Well, our early days are similar in many ways, too, because we both enjoyed the same mentor, Warren Anderson. Obviously, he
That's right.
appointed you, I think, the commissioner of our bill drafting commission down at the Capitol, and he took a keen interest in my own efforts here in Albany County back in the early days. And did some functions for me back in 1986, and then had me join his legal counsel team thereafter when I silver medaled in that particular race. But I know he's touched both of us in many ways, and I often think of him and how I remember him telling me one day in his office in the Capitol. He said, "Peter, I wish you lived in Broome County." That's what he told me. He had been a young town attorney himself in the early days,
Right.
and of course his dad was a legend in his own right.
Yep.
But they were good to both of us, and they must have recognized something along the way. I'm still trying to find what that was that he saw, but he was a special guy.
Yeah, he really was.
Yep.
And he was a statesman. And during the New York City fiscal crisis, where it was very important for the state and the leadership of the state to come together, both Speaker Fink, who was from Brooklyn, a Democrat, and Warren Anderson, upstate Republican from Binghamton area, worked with Governor Carey
That's right.
to make sure that New York's finances were saved at the time.
That's right.
We still, unfortunately, going forward, we still have underlying financial issues. There are 1.5 million people that have left New York in the last 10 years. They're often leaving for jobs and opportunity elsewhere. The cost of government is an issue. The business climate is a real issue. And I wish Governor Cuomo well in this regard. But it's very difficult to change the established order within a system like this. And New York has a ways to go before we're out of the woods.
Well, we look forward to making those efforts in that positive way. Your family, your son's graduated from Albany Law School. And well, that's very exciting as well.
That's right. And he has a job.
Yeah, which is fabulous.
Which is great.
And your daughter is?
She's living and working in New York City.
Perfect.
And recent college grad, and she was lucky to find the job that she did. It's very difficult out there for kids coming out of college now. And,
that's true.
They're coming out with a lot of debt oftentimes, and
that's right.
It's a tough environment, and that's why we see warning signs, I think, around the world as to economies, and the U.S. has slow growth. We don't have the demographic growth to sustain the entitlement systems that we've created. The good news is we're all living longer, and the bad news is perhaps we're all living longer. Right. And during the 20th century, we had the largest single expansion in human recorded history in life expectancy. We went from like 45 to 78, and that was astonishing. Right. And it was all because of public health and medical techniques, etc. But we also now have to deal with the fact that we're going to have many more people living longer, needing many more medical coverage and medical care. So this is an issue that the state is going to have to face with, and all of us in America have to do it. And the key is, how do we restore enough economic growth so that we're not simply trying to divide up an ever-shrinking pie? We have to have economic growth in order to accomplish that.
Well, John Faso, thank you so much for sharing your time with us today. A half-hour videotape cannot do justice to the length and breadth of John Faso, and we're thrilled that you took the time to just share yourself in just a brief way with us today. And we're very happy to have you here, John, and thank you. We hope you come back soon.
Thank you, Peter.
I'm Colonie Town Judge Peter Crummy, and thank you for joining me on Benchmark.